The first part of the discussion elaborates in detail on the reasons behind this phenomenon. As we have previously mentioned, there exists a specific segment that exerts pressure or compression, leading to the shrinkage of the colors of the microbubbles. This particular segment is responsible for creating the observed effect. Upon the release of pressure in this specific area, the microbubbles begin to move away from each other. This movement generates the signals that are subsequently received and utilized for imaging purposes. This concept is analogous to harmonic imaging. It involves inducing movement in regions where there are substantial microbubbles, thereby enhancing the reflected signal emanating from those regions due to the oscillation of their movement, which ultimately results in a distinct ultrasound pulse. Furthermore, it is noted here that the bubbles tend to expand more significantly than they contract. In this context, the process of expansion and contraction of the microbubbles is crucial for the imaging technique, as it allows for a more precise and enhanced visualization of the areas being examined. The oscillation of the bubbles, when subjected to varying pressure levels, contributes to the generation of a unique ultrasound pulse that is instrumental in the imaging process. This intricate interplay between pressure, movement, and signal generation is what underpins the effectiveness of this imaging method. Airports are becoming more than what they are. The movement of microbubbles is not symmetrical, meaning they do not move in a uniform or balanced manner, which can be observed in various scientific experiments and studies. What does this mean? It means that you are supposed to contract or expand to the same degree, or let's say, move with the wave that is incident on you, like the ultrasound pulses coming in this way, which are sound waves that travel through a medium such as water or tissue and are used in medical imaging and diagnostics. What he wants to tell you is that the shrinking and expansion processes occurring in the microbubbles create a frequency different from the incident frequency, which is the original frequency of the sound wave, and this phenomenon is known as frequency shift or Doppler effect in acoustics. This is because there is gas present in some microbubbles, and the gas inside is functioning in a way that causes the frequency I receive to be different from the transmitted pulse frequency, which is the frequency of the sound wave that was initially sent out. And this difference in frequency can be crucial for various applications, including medical diagnostics and research. He told you in this case, what you should do is similar to the idea of harmonic imaging that we were talking about. In this case, you took these ultrasound pulses with a different frequency, and their attenuation will be less than the already reflected signal that we discussed, which comes from the primary source. Thus, the image will appear brighter in the areas where there are microbubbles. You just asked about this topic. Oh, risk. I'm not written in it. Feel free to repeat it. This is what happens. Here is the shape of the microbubbles that exist, and their shape, of course, gives you a brightness signal in this form. So, if we consider the microbubbles, the idea behind them is that their diameter is small, less than 10 micrometers, so they can pass through the stream. The concept relies on oscillating the movement of the microbubbles to cause compression and shrinkage, so that later they produce a frequency that you can receive and translate into the received signal in this form. So, why is the signal coming to you and why is it more bright? Because the same idea applies to tissue harmonic imaging. It hasn't undergone attenuation like the primary signal. When it goes and comes back, it experiences more attenuation than the signal or the ultrasound pulses coming from the microbubbles, giving you higher intensity or higher amplitude or higher reflected signal, which appears behind you in various types. In microbubbles, which are tiny spheres with a variety of applications in different fields, there are things that are used like a layer of albumin, which is a protein, and there are certain types of devices present inside them. These devices can be used in various medical and industrial applications. The idea, of course, is based on two things. It relies on creating a shell or a layer. This layer is compatible with the bloodstream and does not cause any issues, meaning it can move within the bloodstream. So it creates a shell that is hydrophilic for you, while the core is hydrophobic. This is important because it acts as if it is creating an outer layer that is hydrophilic, while the inner layer is hydrophobic for you. then it starts to store here, or the things it will begin to work on. Of course, there are several options available. I might have gathered this from the Airford microsphere and lucellability, gas capsulated within lipid shield, have different applications. There are things used in vascular applications such as the pancreas, kidneys, liver, and tumor vascularization. For example, the air fluorocarbon nanoparticles are preferred to remain for hours after the intravenous injection, and they undergo washout from the liver and from aspirin, which improves imaging. In this case, you want something to remain present. So if you suspect there is, for example, a connection, you want to see it after a certain time or a long period. You need something that acts slowly so it remains present. When you come to perform imaging, you can do it even if it is late, and it will depend on the metastasis present. Also, there are gold-bound colloidal microtubes, which I believe are related to targeted contrast. Target, AL, stands for something important. What they actually use, when I even read this part, I didn't find much about this topic. When I looked into it, I might have taken this from this part. I got it from Airford Physics. I tried to pay a bit of attention to the physics aspect of the topic, maybe the applications or the companies involved in it. Everything has a specific structure, and each structure, for example, affects the washing out of the dye present in it, which has a specific application. These are the 4 types mentioned in Airford Physics, and I didn't find much information about them in many books, but it's enough for you to just know the structure of each one and its application, nothing more than that. However, the main idea or the main concept of microbubbles, as I was saying a while ago, is the idea of oscillation, or the idea of initiating the movement of the microbubbles and keeping them active. In our advanced imaging process, we meticulously perform imaging at a variety of different speeds. This approach is carefully designed to optimize the brightness of the images we capture. By adjusting the speed settings, there is also something that you essentially need in order to do, or to effectively and efficiently stimulate a topic, or that you need in order to successfully perform an action. You need to use or make a movement or action with high power. This means it is greater than a certain level, and it may not be sufficient to carry out the process. You have a certain threshold, as we will discuss something called the mechanics index, which expresses B, the amount of compression or oscillation that will occur. If you increase this mechanics index beyond a certain range or value, it could lead to rupture in the particles present. We will talk about this in the context of ultrasound safety. Tomorrow, God willing, it may not be a large amount, but it is based on the fact that, for example, you are using a specific method that allows you to do it without causing issues. It may be used in targeted therapy. In drug delivery, for example, if someone wants to release the internal components of the microbubbles or the nanoparticles present, they can use high power to rupture the shell of these nanoparticles, thereby releasing the substance inside. This is used in drug delivery systems or in the treatment process, okay? If everything proceeds according to plan, The section that delves into the fascinating details about the artifacts will continue to be included in the discussion, and the segment that pertains to other related topics will also remain intact. We will talk about these artifacts, God willing, and we will also discuss artifacts in relation to physics, as it is dependent on artifacts such as your physics interactions, because it relies on them and the processes that are taking place. Of course, these images may be artifacts for you, but we might talk about them in a way related to physics, explaining why they appear in this specific form, for example, and also showing different shapes that exist, including the ring down. Mirror image artifacts mean we will talk, God willing, about artifacts next time and tomorrow, God willing. We will also discuss, of course, acoustic enhancement and acoustic shadowing, which are very well known, and their role in diagnosis, as well as grating lobes and side lobes. We will talk about speed displacement artifacts and all these artifacts, God willing, and we will also discuss the artifacts related to Doppler. After that, God willing, we might discuss artifacts, and then we will talk about the thermal index, mechanical index, or ultrasound safety. This will be tomorrow, God willing, at the same time at 11, God willing. So, is there a question for the moment? So, after the ultrasound, are we going to start with AR or nuclear? What do you want, Dr. Islam? Whatever you want, doctor.